What are the most common surgical risks for plastic surgery procedures? When considering plastic surgery, it is essential to understand the potential risks involved. Like any surgical procedure, plastic surgery carries inherent risks that vary based on the specific operation, the patient's overall health, and the surgeon's expertise. One of the most common risks is infection. This can happen at the surgical site and can range from mild to severe. Infections can delay healing and may requiring antibiotics or, in some cases, additional surgery. Patients with conditions like diabetes are at a higher risk for these infections. Another risk is the formation of hematomas and seromas. A hematoma is a collection of blood outside of blood vessels, while a seroma is a buildup of clear fluid. Both conditions can cause swelling and pain, and they may requiring drainage to resolve. Excessive bleeding during or after surgery is also a concern. This can lead to complications and might requiring further medical intervention. Scarring is a natural part of any surgery, but poor wound healing can lead to more noticeable scars or even wound separation. Factors such as smoking, diabetes, and infection can increase this risk. In reconstructive surgeries that involve tissue flaps, there is a risk of flap necrosis, where the tissue does not receive enough blood supply, leading to tissue death. For those undergoing breast implant surgery, capsular contracture is a specific risk. This occurs when the scar tissue around the implant hardens abnormally, which can lead to pain and deformity. Anesthesia also carries its own risks, including allergic reactions and respiratory issues. A thorough preoperative evaluation is important to minimize these risks. Surgery can increase the risk of blood clots forming in the legs, which can lead to serious conditions like deep vein thrombosis or pulmonary embolism. Additionally, nerve damage is a possibility, which can result in numbness or loss of sensation in the affected area. Lastly, there is always the chance of unsatisfactory results, which may lead to the need for revision surgery. It is crucial for patients to have comprehensive preoperative evaluations, including medical history and physical examinations, to assess their fitness for surgery. Surgeons should provide detailed counseling about the risks, benefits, and realistic outcomes of the procedure. In conclusion, while plastic surgery can offer significant benefits, it is essential to be aware of the common risks involved, such as infection, bleeding, and poor wound healing. Understanding and managing these risks is critical for achieving safe and successful outcomes. Always consult with healthcare professionals to discuss any concerns or questions about the procedure.